you're good to go.
Okay. Thank you, Sydney. Good morning, everybody. So today we're going to be discussing the anatomy of an SHIPSMP referral. In SHIPSMP, there's actually two different types of referrals. There's one called a complex interaction, and this is pretty much all calls that come in is called a complex, called an interaction. Most complex interactions are cases of Medicare fraud, waste, and abuse or billing issues. So what is an SHIPSMP referral? So there's two different types. There's an SHIPSMP complex interaction, and then there's an SHIPSMP referral. A referral is used in conjunction with a complex interaction. It's what I report to, like if I have to send something to the Office of Inspector General, that's actually called a referral because I'm having to refer it on. So usually during a complex interaction, they require me to get a lot of information from the beneficiaries, or you as volunteers to get information from the beneficiaries. Their name, Medicare numbers, things like that, specifics of that, what the issue might be. Of course, some of these can be very time-consuming and require some research as to see if it's actually fraud or not, or which department I may have to send that referral to if it comes down to me doing a referral. Some of the complex interactions regarding the billing issues requires me to contact providers, go back and forth, get additional documentation, things like that to help resolve that billing issue. So both of these are all called complex interactions. Of course, not all complex interactions involve a referral. So some of them I do not refer on if I can resolve them myself. For example, those billing issues, a lot of the Q&B billing issues, things like that, I don't actually have to refer them on because I can take care of them myself. So each year, approximately half of the SHIPSMP complex interactions result in a referral to OIG. It depends. Of course, the other half are errors. A lot of the Q&B billing issues that I have to deal with, I have to educate the providers on them not billing Q&Bs, things like that. So complex interaction or not a complex interaction. Complaints that Medicare is too complicated are not considered a complex interaction. Of course, we all know, Medicare is very, very complex. There's many facets to Medicare. There's many policies and procedures to Medicare, and that can make things more difficult, and especially beneficiaries understanding their Medicare and what it all compromises. For example, I have to explain sometimes they forget that they have a Part B and Part A deductibles that they have to meet before Medicare will pick up that 80%. A lot of those, of course, are not complex interactions. Complaints related to potential fraud, errors, or abuse are considered, of course, complex interactions. Another thing that's not actually considered complex interactions that I deal with are scams. Now, if it's a Medicare scam, that is a complex interaction. If it's not a Medicare scam, for example, you hear a lot of those different scams that go around, like the grandparent scam, the IRS scam, and things like that. Those are not considered complex interactions, but I will help them forward them on to usually the FTC or the IRS. If it's the IRS scam, I will refer them on to those other entities or help them submit a complaint regarding those scams. So any consumer scams that fall within the scope of the SHIPSMP mission, which pretty much deals with Medicare. You all know we are going to be getting a new Medicare card coming out starting in April of next year, and we've actually already had scams associated with that new Medicare card. So those type things are actually considered SHIPSMP interactions. Here's some examples of complex interactions that I've dealt with. Reporting a potential error by a provider. Beneficiary getting a phone call and giving their Medicare number out over the phone. Any of the Part C and Part D marketing violations, and I usually get those starting around end of August, September, especially when open enrollment starts coming out. We're starting to see all the insurance agents coming out. Of course, if they see something on their Medicare summary notice that for a service that they didn't receive. Another thing that I've gotten before is a senior housing complex where they've gotten agents that have been going door to door and things like that. I've even had some agents where they've offered trips or gifts or whatever in exchange for them signing up. So those are all types of complex interactions. So how to handle a complex interaction? Most of it is gathering information. The most important things, especially if we have to call Medicare for anything, we have to have their name as it appears on their Medicare card. We have to have their Medicare number. We have to have their date of birth. We have to have their address, because this is all things that Medicare actually asked for if we have to call Medicare. So that's some very good information we need. Of course, other information we need is what is their issue? What's the issue? What's going on? So we have to gather a lot of information regarding these referrals. The more information, the better. So what we need when we're gathering information, and I'm saying we because some of you all help me with some of these referrals, and you all actually talk to these individuals before you send it on to me. So what we need to get if we're dealing with anything like this is definitely the beneficiary's name and information. If it's not the beneficiary, if a family member, caregiver, POA, anything like that, we need their information and contact information. What type of service was this concerning? What type of coverage do they have? Do they have original Medicare or do they have an Advantage plan? Because it depends on who we would need to contact. Sometimes we have to contact the Advantage plan. The provider, I need the provider's address and phone number. I need to know if they have submitted this to Medicare and Medicare has denied it and they're doing an appeal. Also, I need to know, did they sign an advance beneficiary notice of non-coverage? Sometimes providers slip these into people and they didn't realize that they've actually signed it, or they do know that they've signed it. Any other information, as much information as you can get for referral for one of these complex interactions is greatly needed. Another thing, listen to see what the issue is. Actively listening. Invite them to explain their situation. Make sure you get the who, what, when, where, why, and how. All of these are, that are vital into part of the investigation if it gets to the investigation stage. So that's the questions we need to get answered: who, what, when, where, and why, and how. And make sure you confirm your understanding of the situation and what the beneficiary wants done. There's some things that they want, the bill taken care of, or, they want you to, contact their provider. Just ask them what they want you to do. Some of them have even said, I just want to report this. I don't want to go any further. And I have to explain to them, well, then if you don't want me to go any further, then I can't go any further than this without your permission. So here's some case note tips if you're taking case notes, if you're taking notes. Describe the situation, be objective and factual, avoid acronyms, and record actions taking. The best notes, and sometimes I even ask the beneficiaries, have you taken notes? Who have you talked to at the provider's office? things like that. If they have a running list of stuff that they've already done, like they called the provider on this day and they talked to this person and they said this. Next one is they called the hospital or whatever on this date and they talked to this person and they said this. Or they've called Medicare on this date and they've talked to this person and Medicare said this. Those notes are very helpful, especially when dealing with these. So if they did take notes, try to get those from them. And also, if you are speaking with the beneficiary yourself, take notes. Or if you have actually tried to get it resolved before you ever pass it on to me, take the notes and let me know what you all have done so that I can piggyback off of that. It might help because then I can say, well, you talked to, the SHIPSMP counselor on this date, this SHIPSMP counselor, and you told them this, and you all still have not, corrected it or, something like that. I can piggyback off that, which is very helpful. So another thing I really need is a release of information. This release of information just pretty much gives them, it's the beneficiary giving me permission to pass this referral on if need be. I like having this release of information because it protects you or me from HIPAA because we are dealing with HIPAA information. So please, if you have them in front of you, get the release of information. If you don't, then let me know you haven't gotten it, and I can mail that. I can call them and tell them I'm mailing it to them, have them sign it, and send it back to me. It's just very important to have a release of information. That way it gives them, they're giving me permission to help the situation. So MSN review, of course, Medicare summary notice. I always tell individuals, please, please, please read your MSNs. And that's another thing that I really need to get to go along with the bill. For example, because some of them will say in there, Medicare may have denied something, but Medicare will say it's not the beneficiary's responsibility to pay that. So that's very, very helpful when we're dealing with, billing issues or things like that. So it's very important for them to actually read those and get copies of them if you can. So if you're sitting down with a beneficiary and you've got their explanation of benefits or Medicare summary notice and their bill, it's very good to look at both of those to see if they actually add up. Did the beneficiary receive the service? Did the doctor actually order this? Was the beneficiary billed the same? So that's another thing to look at. Is the charge or service related to the beneficiary's condition or treatment? And it's very good just to compare and contrast the bill from the provider. So it's very helpful to get clarifying documentation. Anything that can help go along with the referral. For example, if it's a QMB and they require them to pay copays or anything like that, get copies of the receipts where they've made those payments to the doctor so that we can get a refund. Any bills from the doctor's office, anything that would help go along with this referral so that, I can send it all in one lump sum to the Office of Inspector General if that's where I'm sending it to. So anything. Get clarifying documentation. Also, if you do have the beneficiary in front of you, please make sure you copy that Medicare summary notice or explanation of benefits. Anything that they bring in, just go ahead and copy it. Any notes from the doctors, anything like that would help. For example, I've been helping someone do an appeal for a CPAP machine. They had their sleep study done. The doctor ordered the CPAP machine. The only thing, the Medicare denied it because the durable medical equipment provider forgot to date stamp when they received that physician's order. So Medicare's denied it. But in the course of me helping them do the appeal, I sent the sleep study with them. I sent the order from the doctor. Also the durable medical equipment supplier has sent documentation to Medicare stating when they received the prescription from the doctor. So hopefully all that is going to help with their appeal. So any other documentation that would help with the referral is highly recommended. So after you gather all this information, you need to determine who's going to take the next step. Can the beneficiary handle this on their own, or do they need help calling the providers or anything like that? Can they actually gather this information that's needed, or do they need someone help with that? Does the beneficiary just need a phone number or guidance on what to do? For example, I've had one who said, well, just give me the number and I'll just go ahead and call it in myself. Okay, I mean, they were more than competent to do that. Does the beneficiary need help making contact? Are they intimidated by calling the provider's office or calling Medicare? That's where, volunteers and I come in. If the beneficiary doesn't feel comfortable handling the situation, then that's when you as a volunteer or I can step in and help them. Was this just an error? Ask the beneficiary if they feel comfortable just calling the doctor's office and see if they can correct that. And the problem that usually I get the referrals after the beneficiary has already attempted and you, the volunteer or SHIP, has already attempted to get it corrected. Usually I get the referrals after that. So usually we call that inadequate response. So the beneficiaries tried, you SHIPSMP volunteers have tried, or SHIPSMP or staff has actually tried and gotten no response, which, to me, it gives a red light or, red flag up and saying, hey, something's not right here. This could probably be fraud, especially if they're not responding. So after you determine who will take the next step, here is some basic steps for researching a complaint. Of course, determine the problem, get the release sign, get copies of everything, and then match claims to the MSN, to any bills or anything like that. Determine if there's any other documentation you might need. Based on what the situation is, call Medicare. Most of the time, if it's a billing issue or something, I usually call Medicare first to see what that claim actually says. If it says something about, for example, I recently did one where it was for a drug screen, and the beneficiary has gotten billed for that drug screen from Medicare. But when I called Medicare, Medicare told me that they paid that drug screen at 100%, and there was nothing that the beneficiary has to pay. So the beneficiary hadn't sent me that Medicare summary notice, so I asked them if they could send her a copy of that. Now, they can't send it directly to the volunteer or to me or to SHIP. They have to actually send it to the beneficiary, but they're going to do that. So hopefully she can get me that documentation back that states on that where it says Medicare paid it 100% and she doesn't owe anything for that, which will help. Of course, log your volunteer hours. Keep track of those, because some of these situations can take, you can't work it out all in one day, so you have to just make sure you keep track of all the time that you've spent on this complex interaction. Of course, if there's any money returned to the beneficiary or to Medicare, please report that so that I can put that on in my system so that we can actually, because we send all that to the Office of Inspector General, a report each year of how much money has either been returned to the beneficiary or to Medicare. And what I need supporting documentation of that. For example, if Medicare corrected their Medicare summary notice, I need a copy of that. Or if the provider sent the beneficiary a check for the refund, I need a copy of that. Just any documentation to prove, that, SHIPSMP or got their money back for them, or we save Medicare money. And again, if you think you cannot handle the issue yourself, please refer it to me. You all have my contact information, my email, my fax, it all, or my toll-free number. Please, if you don't feel comfortable, or if you've done all that you can think to do with this issue, please pass it on to me so that maybe I can help get it resolved. So working directly with providers, I do this a lot. I call providers. I send them letters. You just have to be nice. Don't forget to be nice. Of course, is it a billing area that the provider can correct? So is their billing in-house? There's a lot of providers that their billing is they outsource their billing. So you're actually not calling that doctor's office to get it corrected. You're calling their billing company to get it corrected. So, and I've had to deal a lot with that. Instead of sometimes calling the billing contractor, I actually call the doctor's office myself, or send a letter to the doctor's office myself to get that corrected. So another big thing, has the beneficiary already been sent to collections? So now you're having to deal with a collection agency, which I have to deal with. I've dealt with numerous collection agencies already. They send a lot of the QMBs to collections when they're not supposed to. Okay, another thing is, is the provider unwilling to bill according to Medicare's rules? I had one air ambulance company that did not send their claim to Medicare, and they were a Medicare assignment provider, and they were trying to bill the beneficiary for like $16,000 for an air ambulance. Of course, the beneficiary didn't have that much money, and I just had to call the company and say, hey, you need to bill this to Medicare. You take Medicare assignment, you need to bill this to Medicare. Finally, they did bill it to Medicare, thank goodness. And this beneficiary actually has a supplement also, so they, were out of pocket for nothing, thank goodness. But if it hadn't been for me pushing for them to file the claim with Medicare, because they were about to send them to collections. Or actually, I think they did send them to collections, but we got it pulled back because they had never submitted the claim to Medicare. So another thing to look at, what type of behavior is how is the provider acting? Are they acting, like, oh, this is our mistake, yes, we will correct it, or, oh, no, this is how we're supposed to bill it. This is how we've been told we're supposed to bill it. So that depends on how the provider or the billing office is acting as to where it might need to go. So another thing is, have we received any other complaints or errors regarding this provider? Are we seeing the same provider over and over and over and over? And another good thing about putting it in SIRS is I can see the providers that I have. I can run a report on all the different providers that I have entered in. So if I'm seeing the same provider over and over and over, it's like, oh, this is a red flag. May need to see what the deal is with these all the same providers. So just be nice if you're talking to any of the providers trying to deal with some of these issues. Sometimes it is an innocent mistake that can be corrected very quickly. So if you're needing to work with Medicare, of course, you've got your unique ID if you call Original Medicare. And I use that. I've got actually two. I've got an SHIPSMP one and a SHIP one. So I intertwine both of them sometimes. Depends on what the situation is. So if you call the 1-800-MEDICARE, they will ask you for your SHIP ID number, and then they will ask you, who are you calling about, and they'll ask for name, Medicare number, date of birth, and their address. So you'll have to confirm all of that with Medicare before Medicare will even talk to you. And actually, Medicare has to go in and look up your unique ID to make sure that the number that you have told them corresponds with everything. So give Medicare a little bit of time because they have to go in and look to make sure the number that you give them is correctly and verify that it's you on the phone. Now, the trick to coming, original Medicare, the 1-800 Medicare is, pretty easy. The trick comes with is if a beneficiary has an Advantage plan. We really don't have any certain points of contact with those Advantage plans. So, for example, I've just been dealing with a beneficiary. She had Cigna HealthSpring, and in order for them to be even able to talk to me, I actually faxed them the release of information, and she's actually told them on the phone, because they've even called her and said, I'm not talking to you. You will have to talk to Lonnie. She's dealing with this issue for me. So they called me, and I sent them the release of information and what the situation was regarding. And hers was dealing with a, I don't know, it's almost like a coordination of benefits. She had her Cigna HealthSpring was supposed to end like March 31st or something, and the service date was in March 28th. And they denied the claim, claiming that she wasn't a current client of that Advantage plan, but she was, because I had a copy of her a letter from them stating when her service was going to end with them. So I sent that to them also. So that's kind of helped, but I didn't have any certain contact name at that Advantage plan. But it seems to be working out pretty good with me sending them just the release of information. But each Advantage plan is different, so it's sometimes very hard to work with those. We do have a complaint module that if you all do have a complaint about an Advantage plan or anything like that, Shannon or Sydney can put that complaint into the complaint tracking module and send it that way. So sometimes it requires me to perform any additional research. Did they have an advanced beneficiary notice of non-coverage? The appeals, is this in appeals, and what step, what level are they in appeal-wise? Is this a coordination of benefits issue? Do they have the wrong dates of service? Do they have, or, especially when people change back and forth from one Advantage plan to another pretty much on a monthly basis, it gets very confusing sometimes. Is there other insurance-related issues in there? For example, if there was a car wreck, is there auto insurance involved, anything like that? Other things that I have to do research on are, is this, something that Medicare will approve? And I have to look up, the Medicare coverage database. I mean, it's massive on what Medicare will and will not cover. I have to look up the local coverage determinations. Any research on Medicare as to if Medicare will pay that or not is very helpful. And I do some thorough research on that before I ever do anything with the claim. So is it suspected fraud or abuse? Of course, most complaints that come in to me, I got usually like 3 different types, either error or abuse, fraud, or billing issues, things like that. That's pretty much the 3 types that I get. So this is suspected fraud or abuse. Most complaints of suspected fraud or abuse arise after a healthcare service has been billed or provided and a statement received. It was the error not resolved at the provider level. So the other thing, have we ruled out was error or fraud? So if we've ruled out that it was an error, then it's most likely a fraud, and I will need to send that on to the Office of Inspector General. The SHIPSMP, this is my SHIPSMP referrals flow chart. So it depends on what type of fraud or abuse it is as to where it needs to go to. Any errors, I can call 1-800-MEDICARE to research the claim and help resolve that with the provider. The DMEPOS marketing, that's usually marketing violations. I usually send that to the Office of Inspector General. Part C and D marketing violations, that's usually I send that to two different spots. I send it to the CMS regional office. I have a contact there, the one in Atlanta, and I also send it to the Tennessee Department of Commerce and Insurance. So I send those Part C and D marketing violations to two different places. Part C and D fraud, that usually goes to the medic, the drug integrity contractor. Any compromised Medicare numbers, I send those to the Office of Inspector General so they can flag those. Any other Medicare fraud, I send that to the Office of Inspector General. Any Medigap fraud or abuse, I actually have to send that to the Tennessee Department of Commerce and Insurance because I do not deal with the Medigap fraud. And they've got their own investigators down there at the Department of Commerce and Insurance regarding those. Of course, Medicaid fraud, I can send that to three different places. I can send that to the Office of Inspector General, the Medicaid Fraud Control Unit, or in this state, of course, TennCare is our Medicaid fraud. And I've done all three of those before. The quality of care, you've heard me mention KIPRO before. KIPRO is our quality of care contractor. They're the Beneficiary Family Centered Care Quality Improvement Organization. So if you have any quality of care issues, I highly recommend you getting KIPRO's number so the beneficiary can report that to them. If they're trying to, if the nursing facility is trying to dump someone out too early or anything like that, KIPRO can help with that. Any other quality of care issues, it depends on what it is. Sorry, guys. It can be sent to the state licensing boards or the long-term care ombudsman. Each region has a long-term care ombudsman. Do y'all know who that is? Do you know who that is in your region?
Yes,
usually they're in, pardon?
We do at South Central.
Okay. Usually that's in with the AAADs is where the long-term care ombudsman is. And they usually help people that are in nursing facilities and things like that, deal with those type of issues if they have any issues in the nursing facilities. And I've actually gotten referrals from the long-term care ombudsman before, or they've had me research something for them. Now, consumer scams, it depends on what type it is. If it is dealing with Medicare, then it is something that I deal with. If it's not dealing with Medicare, for example, if it is like that grandparent scam, the IRS scam, I will usually give them the numbers as to where they need to report that to. Most consumer scams, besides the IRS one, are reported to the Federal Trade Commission. So I'll give them that phone number to report that scam. Of course, with the IRS has their own phone number to call regarding those IRS scams. So as you see with this chart, it depends on what type of fraud or abuse it is as to where I might refer it on to. So how do I track all this? I track this in my search system. So once I get a referral or complaint, once I get a complaint, I actually put it in my SIR system. And of course, SIR stands for SHIPSMP Information and Reporting System. So I enter that, and any other, like if I get any new information or anything like that, I can actually download the Medicare summary notices and all that into that complaint or complex interaction. So that's the thing, or if I finally found like an actual final resolution, then I can actually update that in the file. Also, that in SIRS is how I actually make that referral to the Office of Inspector General, because there's a button that I can click that says send this referral to the Office of Inspector General, and it will automatically send them like an email that says, hey, you've got a new referral from Tennessee SMP, which I think is pretty cool. So, of course, referrals to the OIG hotline, of course, they're all routed to the hotline by ACL headquarters in Washington, D.C. So that's a good thing. So pretty much what I do when I hit that button, it sends an email to ACL that I have submitted a referral to OIG, and ACL will get that information out of that referral and send it to the OIG for us. Now, the person at ACL that does that, her name is Julie. We met her at training the beginning of this month, and she's pretty good at getting that. And if she needs any other information to go along with that referral, she'll let us know so that we can gather more information. Now, keep in mind, referrals to the OIG hotline. So the OIG hotline reviews the information they have received from the SMP to determine, what's the next best steps. They could, open a case for further investigation, of course, refer it to the OIG regional offices, or pass a complaint on to CMS, so whatever they may do with it. And the bad thing that I don't like about this situation is that the OIG cannot follow up with beneficiaries or complainants on the status of any case. So they cannot tell us if they've opened an investigation or what's happening during that investigation. They cannot tell us that, because once they open an investigation, they don't want any information leaked out or anything like that. They don't want a provider warned or anything like that. They don't want a beneficiary going, hey, I got a call, going into their doctor's office, hey, I got a call from OIG about you the other day, or something like that. So they want to protect the beneficiary, or if the referrals come in from SMP, they want to protect SMP, and they want to protect the investigation so that the doctor won't flee or anything like that. So that's why they don't tell us what happens with it. So track and report in the complex interactions. As I've said before, keeping updated notes is very good. I update things like if I've gotten calls back, or if they've finally gotten documentation or something like a Medicare summary notice where Medicare has corrected it, or if they've gotten like a check in the mail or anything like that. I need to keep track of all that. So that's why I ask for copies sometimes, so I can have confirmation that, that I got that corrected for them. So another thing, Medicare does not provide documentation to SMPs. Now, as I said, they'll send it to the beneficiaries, but they will not send it to the SMPs. So that's why I have to rely on the beneficiaries to get that documentation for me so that I can keep track of that. Of course, the value of the SMP program goes beyond the ability to document dollars. That is very true. Of course, some of the documentation may be difficult or impossible to obtain, because there's some billing companies out there that refuse to send a bill with a zero balance on it. Refuse to. So that's why it's very difficult for me to obtain some of the documentation where where they've corrected something. So that's why I rely on the beneficiaries or any other person to get that documentation for me, or even a letter. If they can't send a bill, ask them if they will send a letter confirming that they have corrected that and the beneficiary will have a zero balance. Anything that would help document that savings. And again, volunteers, you play a vital role in this. helping me gather all this information, or helping the beneficiaries out if they have questions, anything like that. I really appreciate you all's help. I'm only one person working this, doing the referrals in this state, so I need as much help as I can get. So, again, thank you all for your help. If you have any questions or anything like that, please, do not hesitate to call me and just ask me, because if you don't know what to do with it, or if you need guidance or anything like that, please do not hesitate to call me on these referrals. And again, and I'm pretty much done, where I guess we can go to questions. Do y'all have any questions? Any questions? Any issues I need to know about? Any referrals you might be sending my way? Have I put y'all all to sleep? Yes, Carol.
No, I'm actually here. This is Judy.
Oh.
I think Carol has her. I just don't have a question right now.
Oh, okay. I see, Carol, you raised your hand.
Lonnie, can you hear me? This is Doug Dolan. I do have a question. It's more of a personal thing. It's kind of more personally related. I work with a ACO group. I do deal with Medicare people. Sometimes in Tennessee there are questions concerning the billing. If it's something simple to resolve, like explaining, like it's, about the deductible, that seems to do it. If it is more than that, I think this exceeds our scope with Medicare. Can I then refer them to local SHIP?
Yeah, or you can refer them to me.
Okay, just refer them directly to you.
Yeah.
Okay.
If it's something you don't feel comfortable doing and you think it's out of your scope, then please either send it to SHIP or to me.
Yeah, it would be out of, like, say, the scope of our ACO program, but I didn't know the correct procedure. Go first to whichever SHIP counselor, whichever region they're in, because they're all over the state, or contact you.
Yes.
Okay, thank you.
You're welcome. Okay, is there any other questions, issues? Have y'all heard of any new scams going around? Okay.
Lonnie?
Yes.
This is Peggy Ransom in Knoxville at the Office
Hey,
on
Peggy.
Aging. Hi. I had a client this morning. I was talking with her, and in the process of helping her, I mentioned she could get a replacement Medicare card. She said she tried, but at Social Security they told her they couldn't do it right now because she requested one a week ago, and she said she didn't do that.
Oh.
So where would you go with that? She has, no proof is what they told her.
They said she requested one.
It was either a week ago or 2 weeks ago or something, but she does not remember doing that.
Oh. Oh, goodness. Then I probably need to report her number as compromised. Peggy, can you give me her information? Because who knows where they sent that to.
Okay. She recently moved from New York, so it might get sort of complicated.
Oh, that does sound complicated.
Not too recently, though. It was May. She moved in May, but it could have been longer, too. She might be remembering it. It could have been, several weeks ago. But
yeah.
I'll just send you an email with what I've got. How's that?
Okay. That sounds good. Okay.
All right.
Thank you.
Thanks.
Oh, Carol, you had a question about the release of information? Carol, can you hear me? Yeah, Carol, I think you had a... I'm scanning down. Okay. Yeah, Carol, you had, yes, there is a specific release of information form that I do use. I can send that out to you all later if you want me to. I can send the SHIPSMP referral form and the release of information. Okay. Yes, I can do that.
Thank you.
Okay. You're welcome.
Yeah. Send it to all of us.
Okay, I will. I can send it out to all of you.
Okay.
Did you all get my email with a PowerPoint in it?
Yes.
Yes.
I do.
Okay. Okay. Good. Okay. So, do y'all have any questions? Yes.
Lonnie, Doug Dillon, I've got another question, if I may.
Okay.
If someone's Medicare card is compromised, what effect have on the beneficiary for services?
It really doesn't have any effect on the beneficiary for services. It has the effect on Medicare because Medicare pretty much kind of like red flags their number. They won't deny claims, but they will actually look at those more closely before they pay for them.
Okay.
Does that make sense?
Yeah. Yes, thank you.
Okay, someone else had a question.
I had a question on vaccines. I'm wondering, is there a particular place that you that's best for beneficiaries to go for vaccines, and also what vaccines does Medicare pay for?
Okay, vaccines? Are you talking about flu shot and things like that?
Things like Tdap. There's a list of them that are recommended, but I don't know anything about where to get them, what's the best place, and which ones are actually paid for or not.
Yeah. Do you have your Medicare and You handbook?
I have it somewhere, yes.
Okay. If you look in your Medicare and You handbook, usually on the 2017 one, it'll list all the preventive services that you can get. Of course, you can also look on the Medicare website and look to see if what you're getting is what's approved by Medicare. I know, like the flu vaccine, of course, is approved because that's a big one for seniors. Things like that, and it depends. I mean, some beneficiaries go to their primary care physician to get these. There's some places, for example, Walgreens, that you can get them done at Walgreens. It depends, but most beneficiaries go to their primary care physician to get those shots. Does that help answer your question?
I know I asked my primary care physician, and he doesn't give them.
Okay.
I don't know if there's others that do, but I guess you have to go to the one you've got.
Well, you can research on facilities that take Medicare assignment, and if they take Medicare assignment, so for example, the flu shot. I've gotten the flu shot. Of course, I don't have Medicare at Walgreens before, but you can also look on there on the website, the Medicare website, about who takes Medicare assignment, and that might help you, check to see which ones would would help with that.
Okay. Thank you.
Does anybody else have any other questions? Okay. Sydney, are you on?
Sorry, I forgot I muted myself. I've been talking.
Oh. I'm pretty much done.
Well, we had a couple questions from the chat box, so let me
Oh,
ask
do we?
you those.
Okay. Hang on.
Let's see.
Are they on?
Can you hear me?
Yeah, I can hear you.
Okay. The first question was, can you send us the release form you would like us to use?
Yes, I'm going to email. I've already told them I'll email that out.
Okay, perfect. Sorry, I wasn't here for that. Let's see. Then there was, do you want us to use a specific release form? You're going to send that to them as well, I assume? Did you talk about
yes.
the release form?
Yeah.
Okay.
It's the
right.
standard SHIPSMP release form you've seen before.
Okay. Perfect. Another question is, Lonnie, you mentioned that you need certain information on the beneficiary. I know of someone that had 2 dates of birth, their actual date of birth, but Medicare had a different date of birth due to a slip of the finger, and until it could get changed with the Social Security office, we had to give the wrong date of birth or the date of birth that Medicare had on file.
Yeah.
So you will probably need the date of birth. Which one would you want?
Well, it's the one that Medicare has on file.
Okay. Let's see. And the last question, or maybe this is a statement. Let's see. A Medicare website lists the vaccines paid for by Medicare and places to obtain the vaccine. So that is also on the website. I think we touched on that a little bit here at the end.
Yeah. Mm-hmm.
But that's all that's in the chat box.
Okay, cool.
So I'm going to stop the recording.